Welcome to those who are joining. We're just allowing people into this wonderful webinar. So if you can just wait a few minutes, we'll get going soon. Well, I'd like to welcome you all. My name's Kathy Borman. I'm the CEO for One Door Mental Health. Welcome to our 4th day of the E-Symposium for Schizophrenia Awareness Week. It's a great Thursday for today. It's a good lineup for the symposium, and we're starting the day bright and early at 10 o'clock here in Sydney time with Professor McGorry. So before we get going, we're going to get cracking pretty quickly because we've only got Pat for half an hour. So we're wanting to really hear and have some dialogue around what is important from his perspective, and especially around early intervention and young people. So I'd like to acknowledge the traditional custodians on the various lands which we're meeting on, pay our respects to their elders past, present and emerging. I'd also like to acknowledge all people with a lived experience of mental illness as we walk together towards a world in which people with mental illness are valued and treated as equals. Just a little bit of housekeeping, because I don't want to take up too much time, but as Professor McGorry is speaking, and you have some questions you'd like to ask, we're not sure if we're going to be able to get all of them, but can you use the chat function on the bottom of your screen? That'll be the only way we'll be able to record the questions that you want to have answered. So if I can get you to know, I've kind of called this a bit of a speed date with Pat. It's wonderful to have him on board. He's the Director of Orygen and Professor of Youth Mental Health at the Centre for Youth Health, University of Melbourne. He's also the Founding Director of the National Youth Mental Health Foundation Headspace. He's a world-leading researcher in the area of early psychosis and youth mental health, and his innovative research has played an integral role in the development of safe, effective treatments for young people with emerging mental disorders, notably psychotic and severe mood disorders. Pat and I were just talking. Welcome, Pat.
Thank you, Kathy.
It's wonderful to have you. And yeah, we'd said that it had been around Pat being able to speak about early intervention for emerging mental disorders in young people. But we were just yarning before, there's so much happening at this time. We know that during COVID, there's a lot that is occurring for people with a mental illness and their families and carers. We've also seen the National Mental Health Pandemic Plan. So I've said to Pat, you go for your life, you speak what you want to speak about. So I'm going to hand over to you, Pat, and we'll take some questions and have some conversation afterwards. So over to you.
Thank you, Kathy. Well, good morning, everyone, and thank you so much for being here today and being able to have a discussion with you. So I'm not going to talk for too long because I would really like to talk to you and just maybe just discuss the issues that you bring up as well. But I decided not to talk about the thing I normally talk about, like early intervention in psychosis and in youth mental health. Although obviously that's incredibly important, and there's some really good things happening around the world in that space, and lots of progress. We've got a launch of the World Economic Forum partnership that we've got with Orygen. It's next week, and so we've got a framework of youth mental health that we're basically exporting around the world based on Australian sort of innovation. So it's really good. Obviously, COVID's putting things in a bit of a different light now, but I wanted to talk about what's happening in Australia actually, and what's happening right now in mental health, especially the issues to do with complex and enduring mental illness, because I think it's really missing out very badly at the moment in the debate, and I'll come back to that in a minute. But I'm just going to share the screen if I can work out how to do that. Let's see now. It's the right one. Yeah, here we are. Yeah. So, and I want to say, I mean, I'm really happy to have been invited by One Door, because in my family, like in most people's families, there's a significant amount of mental illness, and it's serious mental illness in my family, including people with psychosis, with addictions, and so I've lived through this pretty much my whole life as well, just like most of the people listening and participating today have. So I really value the sort of opportunity today to meet with you and talk with you. And I thought I'd start off with one of my favourite lived experience people, Matt Haig. I don't know if anyone's read his books. He's got some fantastic books. He's mainly suffered from severe depression, actually, and he's very, very creative and funny, but he's also an incredibly serious person. If you follow him on Twitter, he's fantastic to follow. And he wrote a book called Reasons to Stay Alive. And I think you can probably read it, but he talked about the things that actually kept him going, and it's very, I think it's very moving and poetic what he says, that there's something positive about the human essence that kept him going, and I think I'm going to talk about suicide in a minute, so that's why I'm showing this. And he talked about the same core we all share, which you can read there, and very deep sort of comments here from a person who's also very light as well. He can be very funny too. So, and just from his Twitter account this morning, this is what he said this morning. I'm no epidemiologist, but I'm pretty sure the way viruses work is that they hang around for 2 months and then people get bored of not going to the pub, so they disappear out of politeness, and everyone can go out again and it's totally fine. So let's hope that's what we're looking down the barrel of, something a bit more positive like that. So anyway, and this is another cartoon that I think is very ironic, that in terms of what Kathy asked me to sort of mention, like the theme of being connected and looking after each other. It's interesting how politics changes quite dramatically when there's a major crisis, and all that individual selfish sort of politics that we're used to seems to go out the window, at least temporarily. And I don't know if we can keep that going, but hopefully we can, and have a much more sort of cohesive and supportive society, because we really need it. Okay, so let's look at what the COVID crisis, or disaster, as I like to call it, is doing. Basically, obviously, we've turned our country and the whole world upside down to save lives from the virus itself. But what we're really concerned about is that the measures that have been taken to actually, do that, to achieve that, those life-saving manoeuvres, which have worked pretty well in Australia, you'd have to say, have actually caused a huge rise in mental stress and mental ill health and anxiety for everybody, and particularly for people who are vulnerable to those pressures anyway, to stress, and because of vulnerability to mental ill health, and also a whole bunch of new people who hadn't experienced that so strongly before. So that's the acute thing. But then because of the economic collapse that's already happening, and it's going to become even worse in the coming months, we're going to see, we know from other disasters and crises, especially economic recessions, there's going to be a significant rise in mental ill health and mental illness, and also in risk to suicide. So we talk about this second curve, or on this slide it says the fourth wave, but we've been calling it in the media the second curve, and we've been trying to get the government to take this seriously, and I'll come back to that in a minute. So we did modelling in Melbourne at Orygen. We've been working on it for some time, trying to work out what the need for care in the community actually is for mental ill health and mental illness. And it's obviously a lot higher than is currently funded. We're probably currently funding it in Victoria at about 1/3 the level it needs to be funded, and it'd be similar in New South Wales. That's why we've got a Royal Commission in Victoria, because of the collapse of what the Premier calls the broken system. I don't think your Premier's been that honest yet. She hasn't actually described it as broken, but it's pretty much nearly as broken as ours, I would say, due to the kind of neglect since the 1990s. But anyway, we've been modelling that, and I asked our modellers to look at what the impact of the COVID-19 crisis would be over the next few years in terms of need for care. And what it shows here, this was in the media last week, Sydney and Melbourne, and it shows about a 30% increase in need for care. Now, we're already underfunding mental health by a third to a half of what it should be. And on top of that, we're going to get a 30% increase. So we basically put that out in the public domain, and we gave it to government in the lead up to last Friday's announcement of a national mental health plan and new funding announcements. And we were expecting that they actually might take it seriously, because that they actually did modelling for the virus and the risk to the population from the virus and the infections of the virus. And they bought heaps of new ventilators and opened a whole bunch of ICU beds, and they turned the country upside down to save those lives. But they pretty much did very little to actually address this prediction of a rising tide of additional mental ill health so far anyway. And we can come back to that and have a discussion about what they might do next. But certainly last Friday did not address this data. And this is scientific data. It's been carried out by researchers at Orygen. And the next slide shows the suicide curves, that the prediction of suicide that Ian Hickey at the Brain and Mind Centre at the University of Sydney have actually carried out. And Ian's got a team of modelling experts that used to work at the Sachs Institute in Sydney, absolutely top experts in this modelling sort of field. Joanne Atkinson's the leader of this team, and they've done some great modelling showing that depending on different levels of unemployment, different levels of school completion, different levels of domestic violence, childhood adversity, all the kind of social determinants, homelessness, all of these other factors that affect the level of mental illness and suicide in the community. They looked at what would happen in the context of an economic recession to those variables, and then they predicted what the suicide rate would be if we don't do something to actually prevent that happening. Doesn't mean these suicides are inevitable or that they're going to occur. So it's not really, people have accused us of being alarmist by even talking about this. They didn't accuse the COVID-19 people as being alarmist in talking about the epidemic itself. But because we're talking about mental illness and suicide, somehow we're alarmist by actually pointing out the facts. Anyway, it's also very sobering. I mean, the minimal prediction is 25% increase in suicide, and it goes as high as 50% in some conditions if the unemployment and the economic collapse is much worse. So it's a similar sort of ballpark to what we were predicting about the rise in mental illness. And of course, we believe that mental ill health is the final common pathway to suicide in nearly all cases. Now, some people in the suicide prevention field try to dispute that. They say not all suicide is related to mental ill health and mental illness. Well, that's simply not true. What they mean is that there are other risk factors like financial stress and so on that contribute to a relationship breakdown that are causal factors, but it doesn't mean that someone who's on the verge of suicide is in a mentally healthy state and doesn't need help. So our argument is everyone that gets into that severe emotional pain or hopelessness or a poor mental state at that point needs to get support, needs to get expert help, and to save their lives, because those lives are all savable or salvageable, because people do not have life-threatening illnesses in themselves. They just have a mental state that's temporarily lost hope. So we think everyone should get help at that point. So this curve can be flattened. There's no doubt about it. If we actually act now and take a whole series of steps, we can flatten this curve just like we've done with the COVID-19 curve. But what we need to do is get government to take it seriously. And so, I'll just I'll stop the share. And so that's what I wanted to finish on. Basically, last Friday, we saw an announcement by the Prime Minister, Greg Hunt, Christine Morgan, Brendan Murphy, of a national mental health plan, which was considered by National Cabinet and approved. It was crafted and put together by the National Mental Health Commission, and it was done pretty quickly, over a couple of weeks, and that really showed. We've had 5 national mental health plans over the last 25 years, and they seem to get worse and worse, in terms of they become wish lists. There's no money or timelines or targets attached to them, but people keep pointing to them as our blueprint, but the blueprint is not followed. And here we have another blueprint, which is probably, more rapidly put together, and it shows, than any of the others. And it's meant to be focused on the COVID-19 crisis, but it's ignored all of this modelling I've just showed you. So some announcements were made on Friday, for example, to actually put more money into modelling and data collection, and also to support some high-risk groups. Now, that's welcome. We're not knocking that. Of course, any additional support. But when you look at the scale of the issue and the underfunding that's already there, that there's a huge disconnect between what was announced on Friday and what the need is. Government might say, well, we're waiting for the Productivity Commission inquiry to report, and I understand from Kathy that you're going to hear from Stephen King this afternoon. I would ask him some very hard questions. Are you going to recommend, that the huge mismatch between need and funding is going to be addressed, or are you going to finesse it? Put him on the spot. He certainly has got all the information. They put the facts out there last year. The only thing they can credibly do is recommend an increase in funding. So I would give him, the opportunity to respond to those questions. But certainly on Friday they didn't do that. There's obviously a need for a further package further down the track, and I suppose rather than just have a go at them for what they haven't done, I think what we need to do now with governments, both state and federal, and I think your New South Wales government and our Victorian government have really been ramping up the pressure here. They've been actually quite good in terms of trying to get the issues addressed. But we need to see action at a federal level now, and there is time. I think those curves will build slowly. So it's not like we have to do it next week, like with the virus. I think we do have, a few weeks to really, secure the sort of investment and support that we really need, so that people, instead of just having more helplines all the time, and I noticed one was opened in New South Wales yesterday, which was probably a best type of helpline because it was lived experience, and that was, and peer workers involved. That's really good. But what good is a helpline if there's nothing behind the helpline? If you just have a conversation and there's no follow-up and no ongoing care, which is really the case with pretty much all of these initiatives. We're opening lots of doors. I know you're called one door. We've got 50 doors and they all lead pretty much nowhere. So we actually do need some serious multidisciplinary holistic care for people to make sure they survive and make sure they flourish and live fulfilling lives. And we've been fighting our whole lives for this, and we're still got a huge task in front of us. And I just think, anyway, I'll stop there. It'd be great to hear your comments and responses and thoughts.
Yeah, thanks for that, Pat. I really appreciate your thoughts, and myself and other CMOs in the mental health sector have been meeting and started to collaborate and talk about how do we start to make some pressure around those important things and what we're hearing on the ground. You spoke about like the modelling being ignored and underfunding. What have been some of the points you've been putting to government that you think are real keys? Because I guess for those of us who are listening, we'd be very concerned about the 25 to potentially 25 increase of suicides. What are some of the things, that recommendations that you think governments need to fund?
Well, I was talking to the Minister's office after the announcement, and I think we've got to be constructive. I've probably been a bit critical of them just now, but there's still time for them to act. And the sort of things that we propose are things they actually put in the plan: assertive outreach, and more digital, support, and I suppose, the sort of things that I think they could do. They have got a plan federally. They've got a plan to sort of set up adult mental health hubs, community hubs, which I think there's a lot of support for that idea around Australia. We did a lot of work with Mental Health Victoria on this, the peak body in Victoria. And also we talked to Carmel Tebbit in New South Wales about this as well. So I think there's a lot of support, and there's a technical advisory group which is designing these hubs, and they'll go out to consultation pretty soon. So this is like a community-based, one-stop shop, which links in with GPs, links in with other NGO services, but it's like a visible beacon of support. And welcoming, you can drop in and you can actually get to talk to someone, a bit like the Hope Cafe sort of idea, except with a lot more multidisciplinary support, not just peer workers. Peer workers will be part of it, but a lot of actually expertise there too. Yeah. And so this has been designed. these could be rolled out much more quickly. I mean, currently only 8 have been funded.
Take a while, Pat. They usually take a while to get these things up and going, because I guess that's the concern when you're looking at that kind of immediacy for what's occurring at the moment.
Well, exactly. So what we've said to the government is, why don't you put 50 of these things instead of 8 of them? Why don't you announce 50 of them, which have to be established within 2 months, and they're a pop-up hub. They're not, you know, you rent a shop front, you know, and you put a few people in it. You get it going, and the first thing they've got to do is be mobile. Go to people's homes. Go to where people actually live. Don't expect them to come to you to start off with because of the COVID situation. It's much better if you know, if you're accessible and you can get the support on your terms, you know. So the people who are trying to help you are guests in your environment. You know, that's a much better dynamic. And so that's something that's very feasible, could be done very quickly, could be done with new workforces, with combinations of peer workers and clinicians, which I think would be really good. We do that with young people already, and we find it incredibly good, you know, the clinicians working side by side with the youth peer workers. So that's something that if they were a little bit more dynamic, like they have been with the COVID-19 in general, we could do that. And it would be cheaper than having, you know, the fully fledged adult hubs. And with Headspace, you could do it for young people by adding some assertive outreach resources to every Headspace. So that's something they could do really fast. And you know, but the problem is, you know, are they committed? You know, that's the question to ask, you know, Stephen, to ask Greg Hunt, and also to ask the states. The states in Victoria, we've had new money for hospital in the home. We've had new money for like a digital platform that is more like a social network type approach as well. So the states, I think, are starting to sort of, you know, commit a little bit more than they have. But the federal government, you know, we've got to stop this kind of superficial stuff, you know, like more advertising campaigns and awareness campaigns and helplines. We've got enough of those, you know. In fact, it's irresponsible to keep doing that if you're not providing services behind those things.
Yeah, no, I hear you. And there's a question that someone's posted around that, which is related about how can we keep all the doors open, provide follow-up care, including all the things you're talking about, without adequate funding for mental health. And then my next bit is, for those of us who are on, what can we do to put pressure on governments and start to have that voice, and not just from being people like us, but consumers, carers, you know, in terms of that, because the pressure needs to be there, obviously. Yeah,
well, they always say if 6 people walk into an MP's office, you know, together, or if 6 sets of groups of individuals actually talk to an MP about an issue, then it gets on their agenda. So I think some kind of organised campaign is important. Yeah, I think that just organising and we have set up a thing called the Strands for Mental Health, which is basically an organisation for lived experience, you know, whether it's family members or people that have experienced mental illness themselves. So we are going to be campaigning. We've got a campaign director now. So somehow we have to mobilise the public or the lived experience voice across, because there's 5 million of us that in any one year that have got lived experience. And if you look about the whole lifespan, it's probably, you know, at least 50% or more. So it's a huge number, but it's incredibly ineffectual, you know, because it's never been organised properly.
Yeah. A question from someone in the audience is, have you heard anything about the National Children's Mental Health and Wellbeing Strategy that was due to be released in June? I'm not sure if it is yet, in the context of COVID and the role of early intervention.
No, well, that's another thing that I think Crystal Middledorf and Frank Goberkleit are co-chairing that for the National Mental Health Commission. So I don't know. I mean, it's looking at sort of younger children, 0 to 12, I think, mainly. So I haven't been very involved in that. But, you know, honestly, you know, it'll be great to have a report and a plan about that. But like I said, plans are all very well. If you don't actually have programs, timelines and money attached to them, you know, they're kind of very dispiriting, because how many plans have we had in mental health over the last 20 or 30 years?
Right. We could have used that for some of the paper we were missing during COVID.
Yeah, that's right. Yes, well, that would have been probably a very good use for many of those plans.
Just in terms of one of the things that was announced last week was the appointment of the Community Deputy Chief Medical Officer, Dr. Ruth Vine. So what do you think the impact she's going to have, or we hope that she would have, to government in the role that she's got?
Well, you know, I was one of the people that was advocating for a deputy CMO for mental health because, you know, it's obviously, after the virus itself, it's the major health issue that we're going to confront. And they did listen to that, and they did appoint Ruth, who, you know, is a colleague of mine from Melbourne. She has been Director of Mental Health in Victoria and Chief Psychiatrist of Victoria, so she's got the right type of background, and she's definitely someone that really cares about people with, particularly with more severe and enduring mental illness. So that's good, because I think the Commission's been a bit light on in that respect. It's been all about, you know, well-being and, common mental disorders, I would say, and probably hasn't focused enough on people with, you know, more significant mental ill health and challenges, and so that potentially good, you know. But I always judge people on results. You know, let's see what they do, you know, and let's see what they say. She was on Fran Kelly earlier in the week. I don't know if anyone heard that, but you know, I'll be watching very carefully to see what Ruth's able to do, and obviously we'll support her if she's going to do something positive. Yeah,
absolutely, and keep feeding up to her what's occurring for services on the ground. One of the questions from the people is, what would you, obviously from a school counsellor perspective, what would you recommend as crucial to do now as school counsellors in order to assist vulnerable youth in schools? In New South Wales, kids are going back full-time next week. Obviously, there's a lot of anxiety about that. I know as a parent, my kids are going back next week. I would love a real flexible education system, similar to what we've seen, especially for us in the CMO sector. We've really flipped to be able to provide different types of services in different ways. I'd love to see that in the education system, but I think that's another whole big discussion. But for school counsellors, what do you think that they can be doing now?
Well, I think they're in a really difficult position. I've got a colleague in Melbourne that's just been doing research. He surveyed teachers across rural and regional schools in Victoria and showed what teachers are actually exposed to, and school counsellors would be as well, obviously, especially school counsellors. The kind of extent of mental ill health amongst young people at school is quite staggering. You know, every teacher had been exposed to at least one suicide, or maybe more, in their career, and the access to care beyond, say, the odd school counsellor is very poor. You know, most of the regional and rural schools were at least sort of 50k or more away from the nearest headspace. You know, or many of them were. Sorry, not most, but in fact, headspace is disproportionately in rural and regional Australia. So it's tried to actually get closer to that, but it's still a big problem. And I think in the metro as well, you know, every headspace is surrounded by probably 20 or 30 high schools, so they can't really have a proper relationship with all of them. So that needs to be incredibly strengthened. And in Victoria, we have a thing called docs in schools, so GPs going to schools, and they also work in headspaces quite often, and also allied health schemes as well to back up the school counsellors. So that's an infrastructure that needs to be strengthened a lot more, and headspace needs to be strengthened a lot more too, because it looks good on the surface, but it's not properly resourced. You know, there isn't enough money really to kind of deal with the waiting lists, and the PHNs have sat on the waiting list money, unfortunately. So even when the minister did do something there, which was very positive, that what he actually did do, this PHN structure has been very, very problematic. You know, in terms of, you know, supporting the services in the field. It's fragmented the field, and it blocks the allocation of money in this way. So it's frustrating, and as you say, in the COVID-19, it's even more of an issue for the mental health of the young people, I think, because of what's been happening. They're very vulnerable, and their education has been disrupted significantly. So I think we need to, and all we've really got from the federal point of view is BU, which is basically an online training program for teachers. So that's not positive, but a lot more needs to be done.
Yeah, I hear you and I echo you. I'm aware of our time. I'd like to say thank you for giving us your time today. Pat has got to be called away to another meeting, which is important, so that's fine.
Sorry about that, Kathy. Could I just say one more thing? Just say, you know, maybe I don't want to discourage people, because I feel very confident we're going to win. You know, this is like a long. I don't know if you know your history, but there are in history with things like the 30 Years' War and the 100 Years' War. I feel like we're in the 100 Years' War, but we've got to keep winning the battles. It is a war. It's a fight. You know, we have allies. We've got to kind of work together, support each other. But we've got to be confident we're going to win. We have made gains and we've made progress, and we'll make a lot more. So I don't feel discouraged at all. And I just want to say to everyone there that, you know, if we, as you say, if we stay connected, stick together, and try to help each other, not be divided amongst ourselves, then we'll achieve our goals.
Absolutely. I'm very much of the belief that for me, One Door, we can't achieve our mission without collaborating and working together. So I think that is real crucial to really make an impact for the people that we're wanting to, the young people, children, adults, older persons, people who are affected in the community. I think for those of us really wanting to make a difference, we've got to be able to reach out and support and collaborate and cross those boundaries and continue to raise the voice, I think, Pat, which I'm really appreciative of that's what you've done today, and you continue to have that voice for not only young people, but for those with severe and complex mental illness. And I want to thank you for your contribution, not only to today, but also to the continual work you do. And for us at One Door, very happy to support and get behind things and talk and continue to talk and collaborate around it. That'd be great.
Yeah, thank you, Kathy, and thanks everybody. Have a great day, and take care of yourselves, and, you know, thinking of you all the best.
Thanks, and for everybody else, thank you for joining. And I just encourage you this afternoon. We've got Dr. Stephen King and Catherine Lowry, the New South Wales Mental Health Commissioner, having a conversation about some of the findings from the PC's investigation into mental health. So I'm looking forward to that. And I'd also, there's a few more coming up this afternoon. After this, if you want to get on board, there's also some, I think at 11:30 today, our partner organisation, Bridges Health and Community Care, is looking at and introducing their Mind to Life Reframing Psychosocial Disability. So that's coming on board. And as I mentioned this afternoon, Stephen King and Catherine Lowry. Tomorrow, if you haven't already touched base, Caring Fairly, there's been a survey for carers during COVID, and there's going to be a presentation on that tomorrow afternoon. And also tomorrow afternoon, we finish with a bit of a jive and a bit of fun with Esther Paverwood, who's from Mostly Mad Music, and talking about the importance of music. So I can't wait to also hang around and talk to her about that as well. So I'd encourage you to get on board, keep having the conversations with each other, keep reaching out. And I think, as Pat said, I think we can all make a difference by just having those conversations where we need to, and let's start, you know, continuing to agitate to make the system better and services better for our consumers and carers. So I want to thank you for being with us, and hopefully I'll see you again soon. Bye.